I think we're gonna get started here. So welcome to our COVID tips session. This is the first of what we're gonna start doing weekly. And this one's gonna look a little bit different than what we're hoping to do moving forward, because we wanted to just kind of introduce ourselves a little bit and just share some of our top things that we're seeing and hearing from our members at TAPI and all of our partners about things they wish that they were doing a little bit differently a few weeks ago when they started immunizing. So kind of like a top 10 mistakes thing. But in the future, we really hope that we can just start all talking on these calls and get these immediate questions asked. So my name's Rebecca Nevedale, and I have been a member of the Arizona Partnership for Immunizations, our state vaccine coalition, for many years. And Jennifer can say hi, tell them who you are.
Hi, I'm Jennifer Tinney. I'm with the Arizona Partnership for Immunization. I've been here for many, many years. We're the statewide coalition who really try to work on provider and community education.
And Maggie, are you logged on to say hi as well? Looks like maybe she's not on yet, but Maggie Macias from the Department of Health Services knows all about ASIIS, and many of you have probably worked with her already around ASIIS, different challenges that you're having with that interface and getting those doses logged in. So she is going to be joining us she's going to try to come on every week so that as you get questions that are really immediate and in your face, you have a place where you can log on and ask those questions. So we're going to reserve at least 30 minutes for each of our sessions weekly, where we can just do kind of an open forum and question and answer things. So, and Maggie's going to talk a little bit later today about some of our top things that we're seeing wrong with ASIIS. So to date, Arizona providers have immunized 1,958,342 times against COVID-19. We have almost 18% of our entire population immunized. This is like remarkable considering 3.5 months ago, we didn't have any COVID vaccine in our state. And what makes it, we think, even more remarkable is that many of these vaccines have been administered by new providers who have built entire vaccine delivery systems in record speed, figuring out all of the IT challenges, the staff training, the protocols, really overnight. And it's just really incredible. We have had 821,108 cases, confirmed lab cases of COVID-19 in our state. And remember, we've been in this kind of pandemic mode really for the last year. The governor's stay home, stay connected order was, I think, March 16th of last year. So most of these cases have been recently, like in the last 3 quarters. So when we think about death rate in Arizona, 16,185 people have lost their lives to this pandemic. This has been incredibly devastating to families and to communities, and especially to healthcare providers. These are your patients. I talked to an internist yesterday they have been monitoring their data, and 50% of their patients who become hospitalized from COVID-19 have not made it out of the hospital. So we know when we give these death rates, they mean something to you as providers and people who work in healthcare. But we've been becoming kind of increasingly worried at TAPI that we're getting really desensitized to these numbers. Nationally, we've lost 518,000 people as of today to COVID-19. And we just reached the 500,000 mark like a week or 2 ago. And National Geographic did this really neat piece, and we should send out the link. We can put it in the chat or send it out afterwards, but just helping us all visualize what that means for our country and for our communities. What is 500,000 people? We want these people to be the focus of our vaccine efforts, because this is what we're preventing. If we took coffins, and for each of those 500,000 people, The line of coffins would stretch 645 miles. It would go from New York City to Indianapolis. If you've ever gone to Washington, D.C. and gone to the Vietnam Memorial, it's a really moving, walk. And it feels like that wall where they list all of the names of the people who died, the Americans who died in the Vietnam War. It's like an 8-foot tall wall. The names are written pretty small, and it feels like it takes you forever to walk through that wall. If we had put all the names of just the 500,000 who died of COVID-19 on a wall like that, this is how far it would stretch. It would be 9 times longer than the current wall. And we have lost 25% more people to COVID-19 than we did in the entire Second World War. And obviously, as numbers continue to climb, this will continue to increase. And remember, this is all within a year, and really all within less than a year. So we really are partners with you in making sure that it's these people's lives, and saving lives is what we stay focused on. And thank you for what you do in saving lives every day, by vaccinating against COVID-19 and by doing everything else that you do typically, helping families get connected to services, monitoring a child's development, making sure that they're growing in a healthy place, and connecting your elderly patients with resources that are going to be able to help support them. So thank you. We are saving lives with this vaccine. And pretty soon we're going to be able to look at these death counts and get even more mad, because we know that soon, once we have a lot of supply, these are all preventable. Most of these are really preventable. So really, though, these trainings that we're doing weekly are to help support you, because we can't save lives without you getting this vaccine in as many arms as humanly possible. The state and county health departments and the public health infrastructure cannot do it without private providers. We all need to work together to be able to do this. And we hope that on these weekly sessions that we can support you and get your immediate questions answered and connect you with experts. But we also hope that you can start supporting each other and saying, we changed this part of our process and we were able to improve our immunization rates by 10% at our last event. And we really hope that you can start sharing those kinds of things with each other. And TAPI's been saving lives for many years. So we have been around since 1993, and we do tons of community resources. We will direct you to our website a lot. We're hoping to create a page where we can post all of the resources that we collect that you say that you need, but also kind of blind your practice title, practice names, and post protocols and things like that as well, because there's eventually going to be plenty of vaccine to go around. And we need to make sure that as providers continue to get activated to be able to provide COVID-19 vaccine, that they can get up to speed as quick as possible. And you'll see we're pretty informal at TAPI. We will try to be interactive, but we will say a million things that are wrong because we're all living in this like crazy, chaotic world, and things are changing daily. So call us out if we do. We try our best every morning to stay on top of what's different and what's new with COVID-19 pandemic response and with the vaccine delivery system, but no, all of us can't know 100% about everything. So make sure you tell us that. All right, that was like a lot of stuff really quick, but we do want to see who all has been to a TAPI training before. So I've launched a poll here. One of the things that's been really cool about this pandemic is there's all these new friends. We have a lot of good relationships at TAPI with primary care, pediatrics and adult primary care, but there's all these new immunizers that we get to become friends with now. So we're just curious if you know us or not yet. And I will close this in just a second. We're not doing any formal research on TAPI. And we have 3 very honest people who are like, I don't know. Why are you asking me if I've done this? I don't remember what I did yesterday. So And just so we can be able to like curtail our trainings better, we want to know what your primary roles are in this COVID-19 in like the delivery system. So I'll give you like a full minute to answer this, but we'd like, if we know who's going to be logging on every week, we will probably plan our trainings a little bit differently. All right, and I'll give you just another 10 seconds here. It looks like we have a lot of clinical supervisors, which is great. I'll give you 5 more seconds. All right. So I'll leave this so you can share. So it looks like most people are clinical supervisors, so our docs and nurses who are making all those clinical decisions about your vaccine events. And then that's followed by vaccine coordinators and your people doing inventory management. And I'm sure that some of you selected all 3 of those. And we're glad we have a few people on making sure that we get paid. And in the chat, it looks like we have some MAs. So the MAs are probably all our friends because we do another tips just for them. And we love working with our medical assistants and think you are all the backbone of our immunization delivery system and don't get half the credit that you all deserve. So, but it's great that you're using that chat to tell us all where you're from. All right. And then one more question. We are interested in how long, oh, maybe I didn't share that. There we go. How long you've been in this immunization world. This is a really important question because there's a lot of new players in vaccines, and it's really important that you all feel comfortable in these calls to ask your questions, because trust us, they're not stupid questions. You know, pediatricians who are vaccinating, you know, this is a core part of their business, lose MAs, they lose, you know, nurses, and somebody new comes in and asks all of the same basic questions about the system. The vaccinating part is actually, you know, kind of easy when you think of it. It's all of these things about getting IT systems to hook up. Who do I have to report to? Where do I order from? All of those things change all the time. And a lot, you'll see as you stay in immunizations for a while that storage and handling requirements will change, ordering systems will change, everything changes all the time, so. All right, well, let's jump in. We are going to do talk a little bit about the COVID system and kind of go over how all of the data infrastructure things work and reporting works. Interrupt us because we know that part's really confusing. And then we're also going to talk about these like top 10 mistakes that we're seeing at the vaccination efforts, and then be able to wrap up. So
can I ask some questions?
Oh yeah, please do.
In between? Yeah, while we had a crisis here with thunderstorm and a lot of snow, we were not able to enter our patients in. And then when we got out of the snow, we had almost 10 employees to enter the data of patients. We did vaccination within 3 days. We did almost 1,900 vaccination, but we had only 1 or 2 people could go to the system. Is there any way you guys can give us more access for data entry so it would be to the system now? we're not getting vaccine because we didn't get a chance to put our patients on time. That's one thing. Two, while we were registering the patient, we noticed the system did not register them, but while our employees said that we did register them, and then they were not in the system. Is there any way we could fix those issues?
So I think the first one, and I think Maggie from DHS is logged on now. So Maggie, are they able to get additional ASIIS pins? What's the process for that?
Let me just clarify the question. Did he say that the information that he was sending over was not processing in ASIIS? It wasn't linking going into ASIIS? And so they now have a lot of vaccines that need to get re-recorded in ASIIS. Is that correct?
No, we finally got it through, but there were some, the system said we did register them, and then when we were looking at the system, the patient's name were not there.
So yeah, they didn't cross over in the interface.
I'm sorry, you said crossover in interface?
Are you talking about data exchange, like interface from your EMR to ASIIS? It didn't communicate where the records didn't get updated with patients' record information and lot numbers?
No, Maggie, I think what I asked, if we could have more access, more password access when we want to enter the data to the system, because we did 1,900 vaccine within 3 days, and then we had the thunderstorm. We couldn't do it for a few days. We had snowy days. We couldn't. We're northern Arizona. And then the next couple of days when we want to enter in, we had no access. Only we had 2 or 3 access people entering the system. Number one, can we have more access? Get more access to our employees to be able to register the information right away. Number two, the difficulty we noticed, our employees, when they were registering the people to the ASIIS system, the system said yes, but when we went back to look up, they were not in the system.
Okay, so I can get your information and I can send you the link directly to you if you'd like, or I can put it in the chat where you can access, it's located on the homepage of ASIIS. It's called a e-profile change request form, and you actually have to request more access to the ASIIS help desk for your employees there.
That's excellent. We'll do that. Thank you.
Yes.
Can I ask one more question while I have you? I have to run to my patients. So, and then regarding Moderna vaccine, initially they were saying 4 weeks, 4 days before or after. Then they said 42 days, 4 days before or after. Now it's 6 weeks, and now I'm hearing rumors it is 93% or 90% people are protected with first dose, and then the second dose is okay up to a couple of months. Is that true?
So Dr. Asghari, you're hopping in front of us on our agenda, but I guess since you have to see patients, we'll let you know. So we do have, this is a big thing that we're seeing because people are getting really freaked out by not getting within their 21 and 28 days. I mean, we're seeing a huge thing with that. So Peggy, Dr. Peggy Stemler's on too, who's my boss. Do you want to give the doctor-to-doctor response to that, just since we have you, on efficacy of that Moderna and probably Pfizer too?
Yeah, so I think
Hi, Dr. Peggy, thank you.
Sure. So the best way to think about this is that, we have to, right now, because all of this vaccine is relatively new in terms of experience and everything, know when I say what we know, this is from the clinical trials that went underway. So what we know for Moderna vaccine was they studied it at 28 days. So you have that 4-day pre-grace period. And it was also studied up to 42 days after administration. So really the window that we know that the vaccine, that second dose will be effective is between that 28 to 42 days. Now, having said that, we also know from other experiences that vaccines can be boosted, but the official knowledge, is you have an official window of up to 42 days. We don't really recommend that somebody start an additional series after that if they don't get the second dose within that window. Does that help?
Yes, thank you.
Sure.
And then with the new vaccine, with Johnson & Johnson, is this only one dose for 6 months and then they get another dose in 6 months down the road?
So at this point in time, the recommendation for the Janssen or Johnson & Johnson vaccine is one dose. There's not at this point in time a necessary recommended booster for that.
So there is no, I don't know if I cut out or Peggy cut out, but there is no booster recommended at this time for Janssen. Just a single dose.
Sure. And then what about Moderna? I heard rumors that people after getting their second dose, then within that grace period that you cleared for us, we're looking in down the road in 3 months or 4 months getting, or at the end of the year getting the booster shot. Is that correct?
So we get the question a lot, and I'm sure a lot of you have gotten the same question. Will this be an annual vaccine? And the answer to that is that we don't know yet.
Okay.
Because again, we have the recommendations from the clinical trial, from the stage 3, phase 3 trials for what to do. But there's a lot of information about vaccine that we don't know yet, primarily because it's relatively new. So we don't know whether it will need to be annual. We don't know, whether you'll need an annual booster. We don't know if it is effective, meaning scientifically proven with the reliability to go out and make policy decisions based on, how effective it is against some of the variants that are appearing. So I'm sure you guys will be talking about that further on in the presentation as well. So Rebecca, I can hand that back.
I think too, all these clinical things, if we need to do reserve some time because we do have a lot of clinical folks who logged on today and might in the future, we can certainly do that. I mean, we can have identified docs from either the state or the county who are really up to speed on all this stuff and give you all 15 minutes. So be sure to just shoot us an email or put it in the chat if you think that that's going to be most helpful. And let's go back to working out some of these ASIIS things, especially for people who are newer to vaccines and are really confused about how this system's all designed. Does that sound good? Thumbs up.
Yep.
I see. Okay. So Jen, data inventory exchange and all of that, can you kind of give us a level setting on what are all these acronyms? Where do we get vaccine? Where does it come from?
Yeah, and this is just an overview, but this just kind of gives you an idea of how the distribution is working. So the CDC sends ADHS the number of doses that Arizona is going to receive in the allocation that's coming up for the next week. And that's based on population. ADHS divides that out by the counties, again, based on population. And then the counties allocate those doses to the providers and partners based on which tier groups we're in and the availability of the vaccine and where the locations are for those providers. So up to now, we have not had a lot of vaccine in the state, and they've been going to these big pods, which is a point of dispensing, these big clinics for people to do drive-through, and it's based on the, first it was healthcare workers, then anyone over the age of 75. So it was really geared towards that. We're just getting to a point where we're getting enough vaccine that it's now being allocated down to the private partners. That's done by the county health department. So then what happens is once you get allocated vaccine, ADHS will link those doses to your provider account in ASIIS. And then that shows you what inventory you have. From there, you accept the doses in ASIIS, and then the doses are shipped to you by the CDC distributor, McKesson. So then you'll start to receive those vaccines. So then you administer the doses, you report the patient record back to ASIIS, and then the vaccine inventory should automatically adjust down because you've reported that you gave John Smith a COVID vaccine, and it'll decrement off of your inventory. And Maggie's going to go through that a lot more in the end, but that kind of shows you how they begin to track those doses and the allocations. Then you bill the health plan for the administration fee, not the vaccine itself, because this is federally supplied. And then ADHS runs those doses administered reports, sends them over to the county to track the allocation and to see who's giving vaccine where. And then ASIIS also reports that inventory to the CDC, which then they can begin to see that they need to give us more allocation the next week. If you want to go to the next one, this is where it gets really confusing as well, because you have a lot of places that you're reporting inventory, especially right now as all of the systems are kind of coming together. And of course, everyone from the president down to the governor to the media all want to know how many doses we've given minute by minute in the state of Arizona. So you report those patient records and the dose inventory goes through ASIIS, but then you've also been asked to report it to the CDC's vaccine finder so that they can quickly see day by day how many doses have been given. That's not patient level. You also get an email from ADHS with a daily survey to say how many doses did you give, how many appointments do you have coming up, and what % do you expect to use by the end of the week, so they can begin to look forward to the next week's allocation numbers. And then many of your local health departments are also asking you to let them know how many you've used, what your inventory looks like, so they can start that pre-planning for the next round of allocation that comes through. Some of you are getting vaccine directly through a federal supply from the CDC, and all of that is reported through a different system called Tiberius and Vaccine Finder, because that's federal. But most of the private providers in the state are going to end up getting this local allocation. Some of you may choose to use ADHS's vaccine management system. That's a registration system where patients go in through a portal and they make an appointment based on a clinic that's close to them. And then you all get to go into the back end of that system and then make those appointments and hold your clinics and report the inventory that way. If you're using the state's vaccine management system, or VMS, that's going to report directly to ASIIS for you, and it'll take care of the inventory that way. But you'll have to pull that data out and get it into your billing system in order to bill for that, because it's not a complete EMR or a practice management system. So that's just a quick overview of the systems, because I know it gets confusing. We use a lot of acronyms in vaccines, from the vaccine itself down to every department that works with vaccines. But this will at least give you a little bit of a footprint of, you know, who may be reaching out to you and who you will be working with.
And I think, and there's a question in the chat about allocations and pediatrics. So the way that, so FQHCs and pharmacies can request vaccine directly from the federal government, but nobody else can, right? It's just FQs and pharmacies. So private
and NIHS.
NIHS, yeah. So private offices, you request your vaccine from the counties. And if you are onboarded and activated already in ASIIS, which many pediatricians already are, you can already request vaccine for request vaccine. And several pediatricians throughout the county have been administering COVID-19 vaccine. But remember, because we're doing a phased prioritization rollout, at this time, pediatric patients probably aren't in that groups, because right now we're doing individuals age 55 and over, and then the school and childcare personnel. And I don't think we can send out the phased link of that. Now of who's in priority. Now the state has the list of priorities. Some counties may have a different It may look just a little bit different or roll out a little bit different. So many of you probably remember, the state did open up to ages 65 and over, but it was a few weeks before all of the counties also opened up to 65 and over at their immunization events. They were still only allocating those county doses to people 75 and over. So there's another question about, do they get reported to VFC if they're adults? So all COVID vaccines do have to be input into ASIIS within 24 hours of being delivered. So I don't know if Pamela, if you're thinking that VFC and ASIIS are kind of connected. So they don't have to get.
That's where.
Oh, go
yeah,
ahead.
that's where they use the PAN designation, and Maggie's going to go through that later. So when you check the funding source, you're used to checking VFC or private, and now you'll have a third choice, and Maggie covers that a little bit.
May I ask you a question? We were in a national emergency with a thunderstorm. Why is that so necessary to do it within 24 hours?
So that is in the governor's executive order
Okay.
to report those within.
So we should prepare have some laptops at home from now on. If we were still running into problem, be able to enter them from home.
Yeah, I know that a lot of providers are having challenges getting those into ASIIS within 24 hours. And next week, we're going to talk a lot more about ASIIS, and those of you who do serve pediatric patients. Pediatricians have been interfacing with ASIIS, since it was born in 1993, and have done the lion's share of the legwork of figuring out how to get their EMR system to hook up. So
Rebecca, I just noticed you mentioned in the beginning there were almost 2 million vaccines being done in Arizona, which is amazing.
Doctor,
What a great team.
I think that this is not a conference just for you. Would you please let them give their presentation? If you have lots of questions, then call them later.
Okay, you got it. No problem.
thank you. All
You're
right.
welcome.
Love to talk. Yeah, we know that this is really hard. It's a steep learning curve for many people. So I do want to make sure that we get back to the chat around this data system. So Bobby's asking, can you clarify the requesting process? Is this the same as creating an order? So you request vaccine from your county. So they will have each county has their own provider request system for how to request those doses for COVID-19. And then the creating an order, what's that, do you think, referencing, Jen?
So within the ASIIS, you could usually submit an order for your VSC vaccine, and then that's how you manage it. In this case, the counties will allocate it to you, and then you'll go into your ASIIS order set, and the order set will be there that'll allow you to hit the button of, yes, I accept this vaccine, and then it comes into your inventory. So it starts with the county having to do that with ADHS first right now, because there's not enough vaccine for everyone.
Right. Yeah, and if it's helpful, we can try and do some legwork to dig around for each of the counties. So if you want to know what your county's request, just write the name of your county into the chat box right now, and we can send that out afterwards. And we oh, sorry. Did somebody else?
Yes, for Alexandra, meeting for Alexandra. So we are a private small clinic, and we just received an allocation of 100 vaccines just an hour ago. And we received the allocations from the health department. However, we were not able to order from ASIIS. So since you said that we have the option to order from ASIIS, but our clinic doesn't have that option.
So you don't
It might
vaccines from ASIIS. You order your VFC vaccines from ASIIS. Sorry,
So,
Jen.
and Maggie might know a little bit more about this, but I think it takes a little bit. So the county just alerted you, you can order 100 vaccines in the next allocation, which again, isn't happening, until I think it's Friday and Monday. But so it might take a little bit for that to land into your ASIIS account because they have a lot of back end stuff. But Maggie, do you have any more insight into that?
No, actually, we just place the orders on Fridays typically, and we try to get the orders processed that Friday so you can have them within the next week of Tuesday. We try our best, and unfortunately, that's as quick as we can get them out.
So maybe the system will update within Friday, maybe.
I would look back on Friday.
Okay.
Yeah. So there's starting to be some questions specific to ASIIS in the chat. Please keep putting them in there. Next week, we're going to spend all our time just on ASIIS. We just wanted today to make sure that we gave a broad overview because we know some people are having questions about what's the difference between ASIIS and Vaccine Finder and VMS. So this was intended to just kind of map things out. Write those ASIIS questions in. If Maggie doesn't get to them today, then we will spend a lot of our time next week on those. So, and I do want to just go over kind of quickly about some of these things that we're seeing. If you're new to COVID vaccine or you haven't started your COVID vaccine program yet, a couple mistakes that we're seeing. So there's a group of private providers who are doing things in their offices if they have those eligible patients who have been prioritized. And then there's also groups that are doing these pod events, pop-up pod events or community events partnering with churches or employer groups. There's a pediatrician's office in North Phoenix that has a tent outside their pediatric clinic, and they're immunizing just people, older people in their community. So dosing intervals, we talked about already a little bit, I think. There is a 28-day minimum for Moderna, 21-day minimum for Pfizer. There is a 4-day grace period for each of those vaccines. Johnson & Johnson product will be a one dose, but we're hearing a lot of people who say that they were told by a provider that if they had COVID already, they need to wait 90 days in order to get their second dose. That is not true. You are able, as soon as a patient is out of isolation or quarantine, they can be immunized against COVID-19. Obviously, we don't want anyone who should be isolating or in quarantine going into your practice or at your mass immunization event. But otherwise it can happen within those 90 days. And then the other thing with dosing, remember that if you, like Moderna is a 28-day grace period. If you gave a Moderna shot 23 days later, you do need to call that patient back in. That vaccine does not count. So, and for those of you who are getting a little bit newer, we would say, people are really getting very nervous about not getting their shot within the 21 or 28 day period. So that's an important heads up that they call, they email, they get on your Facebook page. People are really nervous and want that vaccine. The second thing that we're really seeing is people aren't anticipating demand appropriately. So if you are partnering with a church or with an employer group to vaccinate their employees, don't ask how many employees do you have or how many people are in your church group. You really want to try and figure out how many people in their population are actually going to want to be vaccinated. Especially as we continue to immunize more people at these state and county pods, and the more ages are opening up, we're going to have a lot more people who've already been immunized. And if you have some good tips on how you've been able to anticipate demand, please, chat them in on the chat box, because this is something that's really, really, a challenge for some people, and we can't waste any doses. Our third thing that we wanted to make sure folks who were just starting knew about is that Scheduling these appointments has been a challenge. If you're using the VMS or if you are not using the VMS, people think that they booked appointments that they didn't. They will come into your office, waving papers that have their name on it that they think they booked an appointment. You need to confirm those appointments, email, text, make sure you have all of those protocols and systems in place. You need to over communicate when that appointment is. You do need a protocol for walk-ins because you will get people who come thinking they have a scheduled appointment and they don't. And you want to try to plan for that so that you'll have a dose ready for them. And scheduling the appointment for that second dose right away is definitely a best practice. And the other thing we would say around scheduling is you're going to get a lot of questions from people about their appointments and about when their next appointment is. The quicker you can respond to those questions, the better off you're going to be. Because what happens is if someone doesn't get a response within 24 hours or 20 minutes, for some people, they will call the county, they will call the state, they will call the host site, they will call their local hospital system, they will call everyone trying to get an answer, and they might get wrong information. So make sure that you have communication systems in place and that your front desk folks, everyone knows how to track down those appointments. Another thing that we're seeing is that people are, they're showing up to these appointments either really anxious, really nervous, or just really happy, excited, humbled to be getting a shot. And anything you tell the patient before they get their shot, they forget, like everything. So if you have really important things, like here's how you schedule an appointment, or you're going to get emailed a link, but our scheduling system's going through upgrades, so it's going to be a dead link, just ignore it. Give all of those important pieces of information after they get their vaccine. Posters in observation areas or in waiting rooms, making sure that you, again, have those communications set up so that they get confirmation emails or confirmation texts. It's going to reduce the phone calls substantially. A lot of people report not receiving their immunization cards. I'm sure that many of those people forgot their immunization cards, and the pediatricians could probably keep you on the line for hours talking about how many blue shot card, books have been lost over the years. So we do want to make sure that you do give it to everyone. You need to indicate the immunization type that was provided and the lot number and all of the other information on that. And for the second dose visits, you need to coach your patients to bring that immunization card back. Know that as supply becomes more, as we get more supply, there's going to be more supply in the community. So your patients are going to be able to access vaccines at other people, at other pods, at other practices, through their employer. People are going to start crossing over systems quite a lot. So these cards are going to be really important. You're also eventually, and these vaccine cards are delivered with the ancillary kits, which have all your swabs and your needles and things like that. And they show up a couple days before your vaccine shows up. So you are going to need to, we know that at the large pods right now, because we've only had, if someone says they went to State Farm, they got Pfizer. So that you're able to give them another Pfizer, whether they have that card or not, as long as you can figure out the day. But eventually, as we have Janssen, as we have AstraZeneca, and as we have everything else, you're going to need to start looking people up in ASIIS to know what vaccine you need to give them to finish the series. So make sure that you start testing those workflows to do that now. And the anxiety of this vaccine is like something we've never seen before with any other vaccine. People are incredibly nervous at those large pod events. You have EMTs running car to car because people are having panic-induced, episodes, not real effects. You really need to prepare your staff your whole staff for this anxiety that patients are having for this vaccine. Your front desk people need to know, be prepared that people are going to just charge in, you know, is this going to hurt? And they need to know just how to listen to those people and respond to them and make them feel more comfortable. If you're doing drive-through events, your greeters, your traffic control people, obviously your immunizers and the folks in your observation area, but everyone needs some sort of training on how to make people feel okay. And that doesn't have to be a huge webinar or a giant training. It can be something as simple as a reminder in your huddle in the beginning of the day that when someone says, is it going to hurt? You know, it's perfectly okay to tell that person, yes, it's going to hurt. I got mine and it hurt, but I'm okay. You know, I'm back at work, you know, didn't hurt that long, and be able to make them feel a little bit more comfortable. But not everything's going to be a panic. There's going to be panic attacks, but not everything's going to look like a full-blown panic attack. So, and we are finding that the observation area or the waiting area where the patients sit, so they have to be observed for 15 minutes, 30 minutes if they have some sort of a severe allergy. But that is a good place to help reduce those anxieties. We had an event at Dysart School District 2 weeks ago, and they had this youth development program called the Be Kind People Come. They have this like really cool psychedelic van looking thing, and they sing and dance, and we're able to make announcements, and the kids are all excited because now they have all these songs about vaccines that they sing. I mean, it was a completely different atmosphere, and they had four people out of like over 700 vaccines that EMTs even had to go to. It is like drastically smaller than other events that we've done with similar populations. So not everybody can have a van with singing and dancing kids, but play some music. If it's in their waiting room, give them something to do. And if someone does start having an episode like a panic attack, or, you know, if you think it's an actual reaction, if possible, bring that patient to an exam room, or pull that patient from their vehicle and bring them somewhere that's behind like your pop-ups or something like that. Because what we find is that when someone's having an episode and there's a provider there or an EMT there, everyone else around them then all of a sudden starts, you know, not being able to feel their arms or hyperventilating, and, you know, it just kind of freaks everybody else out. I think I want to go to, we do have billing stuff, but I want to make sure that we have time to go over what Maggie sees as like the top things that are wrong, that top mistakes that see in ASIIS. So Maggie, do you want to talk to these things?
Yes. So the common errors that we see in ASIIS is not receiving your vaccines in ASIIS. So I'm going to go ahead and go through the process in receiving your orders in ASIIS. So regardless of what system you're using, it could be an EHR, VMS, ASIIS, you have to receive your orders in ASIIS. So when your vaccines arrive physically in your facility, you want to make sure you go directly to ASIIS, log into ASIIS, go to Orders, Transfers tab located on the left-hand side of ASIIS, select Create View Orders. You'll want to navigate to your inbound orders / transfers. You want to make sure you're verifying the information that you're receiving with the vaccine, the expiration date, the lot number, the quantity of doses that they've sent, and the quantity of doses that ASIIS reads. You also want to make sure that you are verifying the expiration date. ASIIS may show that it has 12/31 and it expires 2069. We are not sure why that's appearing like that, but you want to make sure you verify the expiration date in that placeholder and make sure you change it. As you can see on the left-hand side, you'll enter your receipt quantity, and then you'll enter your lot number in that tab there. Make sure it matches with what you have on your box. Your expiration date, again, make sure you update that information, and you'll want to hit the receive button on the right-hand side. If you do not receive your doses in ASIIS and you start administering the vaccines to your patients, it will not decrement from your ASIIS inventory, and it's going to cause a whole whirlwind of issues. So if this does happen to you, please give us a call at IPO, and we're more than happy to help you troubleshoot this issue. Sometimes you will have to either go back in manually to update the record individually to each record, and that takes a while, or sometimes some EMR vendors do have the option of resending the vaccines to have them link and decrement properly. So it's very important to receive your orders in ASIIS. Next slide, please. Again, I want to emphasize the expiration date. This is a common error that we have right now in ASIIS. So you may see the 2069, of course, a vaccine does not expire in 2069. So please make sure you go into that tab, the expiration date, and update that. The expiration date is for doses placed in the proper freezer type. So doses placed in the refrigerator or drawn up must be used more quickly. Go ahead, next slide, please. This is very important and very common. So right now I am troubleshooting daily the funding source. What's causing the main issue for decrementation is the funding source. They're selecting the incorrect source. Some are selecting VSC, some are selecting private. It has to be PAN. So if your EMR vendors are not aware, you can always provide them the CPT codes and CVX codes that are located on our homepage of ASIIS under valuable links, where you can provide it to your EHR vendors and let them know and make sure that they've updated the funding source and the eligibility. If you do see your vaccines crossing or your vaccines not decrementing, and then you look in the patient's record and you see that it has the incorrect funding source, that's the reason why your vaccine did not decrement. And you can always, there's a little helpful tip here, is you can always go to your patient detail report in ASIIS, run that report, and check to see if your vaccine's decremented. It'll say under decremented yes or no. And if it says no, you'll look over to the funding source and you'll see it's either empty or they sent the incorrect funding source. So this is one of the main issues that we're having right now and we're coming across. So please make sure that you are selecting PAN for your funding source. Thank you.
I'm muted. So we still have a few more minutes. So there's a question from Maria saying, for us, funding source PAN is there. The problem that we're having is lot facility. Is that on this screen?
No, that's not on that screen. I can go ahead and answer that. So it might be that your EMR vendor is sending the wrong ASIIS client ID, which that's more technical. It's either missing or it's they're sending the incorrect one. So I can send you right now, I'll add it to the chat, all the requirements that need to be sent in your vaccine from your EHR vendor in order for it to decrement properly in ASIIS. And you can look at that as well and make sure that your MAs, when they're selecting in your EMRs, they're selecting the correct funding source, the eligibility, all the required fields.
And then there's another question about updating demographic information. We do ask you to do that. It is best practice with ASIIS because we use it to be able to do reminder recall. I'm not sure if most providers are doing that yet. Do you think so, Jen?
No, I don't think so. But if you're in there manually updating it because you don't have that HL7 connection and you see that something is really off, try to get as much of the updated information in that you can. One, it is used as a reminder recall to say you're due for your next dose. It's also used if a lot is ever has to be recalled totally and people have to be revaccinated, like if it was at a temp range or something like that. So it is nice to have the patient contact information available if possible.
Yeah. And then there's another question about, so a week after 28 days, patients will have to start all over now. And the answer to that is no, we are not restarting any of the vaccine series. If you've had one, at all. So even if you got a Moderna December, when did we get it? It feels like Christmas. I know I was doing this Christmas Eve. So you got it December 15th, and next December 14th or 15th, you want one, then you don't start back over. If I set up as a private and it's zeroed out in ASIIS inventory, will I need to correct it? Sounds like that's a Maggie question.
Let me look at that question. Where was that question at?
Right at the bottom of the chat now.
Junior patients.
From Kira. Kira? I'm sure I'm saying that wrong.
Okay, so if I set as private and it's zeroed out in ASIIS inventory, will I need to correct it? Yes, you'll have to link your patients.
Mm-hmm. And then Becky's asking if they do their patients and their parents. So you do pediatric patients 16 and over for Moderna and their parents who aren't in the EHR. What do we do? You can provide vaccine to their parents and you can bill for that. You will need to enter them into your EHR system, probably to have it hook up to your billing system. So you will need to enter those adults into your EHR for the billing, and then you do need to make sure that they're in ASIIS. So if you don't have the HL7 interface, then you'll have to manually enter them.
And I know some clinics, depending on the EHR, are able to set up an event in the EHR that they add in any of those walk-in or non-registered patients. So you set up an event like you're doing a community event. That way it's in your EHR, you can bill it, but it doesn't get counted back in as your usual everyday patient.
And remember that the parents would need to be in the eligible population right now. So they would need to be 55 and over. And, you need to talk to your county about what, whether you can do other kinds of groups or not. It's really, all of this stuff changes about who's eligible and private providers and then these large pods. It's all changing constantly. So, this is being recorded from what day is it? March 4th. And it will be 2021 and it will be out of date by March 5th, 2021. Very likely. That's just what it looks like right now. So, and I think we have time for one more. So I'll just go to the bottom. So what is the required patient information to record in ASIIS if we're administering vaccine during a pod and patients are not already in their EHR? Are there required fields for that? Do you know, Jen, if there's required ones? It would probably be.
Yeah, there's a list of, of course, patient name, date of birth, your location, race, ethnicity, if possible, to get those. I have a whole list, and I'll post those with the slides here of that full list. So it's what you would typically report for a childhood vaccine is about the same for this one as well. The differences are race and ethnicity. The CDC is trying to track that to make sure that we are in communities that are underserved.
Yeah. All right.
No birth order, mother's maiden name, and guardian, those don't apply to adults. So that shouldn't be an issue.
So we will be sure to listen to this recording and then also really comb over that chat. So continue chatting in your questions and things like that so that we can plan the session for next week. We're also going to put in the chat a link to it's not a detailed evaluation. We were really just hoping to get specific topics and specific questions so that next week we can do kind of a rapid fire Q&A with Maggie. And be able to ask questions of her that she will know the answers to and be able to show slides with the ASIIS, what it actually looks like. So please be sure to do that, or you can always chat them in and email us. We are hoping to do these weekly, so we want to make sure that they are a good use of your time. And we do recognize that we're going to have to just continue adapting as we go along, because it's all a moving target for all of us working in vaccines right now. It literally changes every morning. So that's why things look like this. But we just want to be a place where you can get those immediate questions answered, and just really appreciate everything you're doing to save lives. So we will hang on probably for just another 5 minutes or so, just to make sure that that chat stays open and you can put things in. And if there's anything else you want to say, we'll be here for 5 minutes. But otherwise, go ahead and log off. And thank you all for what you're doing.
Thank you.
This is Kevin Dang. I just want to let you know that this web meeting is very helpful. I do have one quick question for Peggy, though. She mentioned that earlier in the meeting that the Moderna product, patient can wait until 42 days to get the second shot. What about the Pfizer product?
For that, it was studied up to that time period for both of those shots. So again, that's kind of the official, like what has been studied for each of those two first vaccine types.
Got it. Okay, so for both Pfizer and Moderna, they can wait up until the 42nd day from the first shot to get the second shot.
Yeah, and that will really come into play to help people manage anxiety if they're having, kind of trouble getting an appointment, because people hear 21 days for Pfizer or 28 days for Moderna and feel like if they don't get it on that day, it won't work.
Got it. Thank you so much.
Okay.
And Peggy, there's a question on there about peds. They're just doing peds trials now, right, for Pfizer and Moderna. So we don't know when they will open up to under 16 for Pfizer, or under 18 for.
Yeah, I believe that the clinical trials for ages 12 and over are sort of, anticipated for early summer. Not just Arizona summer, national summer. So, sort of June, July. But of course, that's a soft date right now. And again, the reason that the age for I don't want to get this backwards. Somebody else remind me.
Moderna
16 and
Pfizer 16.
Pfizer 16 and Moderna is 18 is just because those were the populations that the studies were done, that the clinical trials were done. So that will be coming soon for younger kids. Mm-hmm. We know that, especially for those of you who see younger kids, and also for teachers in schools, that's a very popular question right now. How soon can we get the kids immunized?
Peggy, I have a question.
Right now are us grown-ups, by the way, epidemiologically speaking. So,
Peggy?
Yes?
I have a question for you. You mentioned earlier, and I even noted it down on my notes, wrote it down on my notes, that if they miss that second dose, the 42-day window, it is not recommended for them to restart the dose again. Is that right?
Yeah, the series. They are certainly, you certainly can give them a second dose, but you do not have to restart a series. So you don't have to give them two doses in that time window at this point in time,
Okay, so they just get 2, not 3.
Correct. Yeah.
Okay. Yeah, because we've had several people mention that they have been told that they needed to restart the whole series, the series of the doses.
Yeah.
Okay. Thank you.
Sure.
I wish that everyone was doing all this research about like getting their next HPV shot for their kid, or when was your last tetanus shot? Did you do that within the recommended days, years? Okay. Oh, well, there's a question from Ryan saying, are there pods in Central Phoenix to shadow one? If you're interested, I would contact whoever, if you're already doing pods or planning pods with Maricopa County, ask your liaison who you're working with to hook you up with someone who's already doing a pod so that you can go and kind of sniff around. There's also a lot of resources on TAPI's website. We've been doing a lot with our medics and fire departments on doing their pods. So there's a bunch of webinars and things that you can watch too. But ask your liaison for contact information. Yeah, and then the banner ones too. Oh, I see Jennifer gave you a different response. That's all right. They'd all get you to the same place.
Sorry, yeah, it does. I've got his email, so I'm gonna get him some contacts.
Are you with a private practice trying to do pods, Ryan?
I'm with a free clinic, so we're trying to reach vulnerable populations. So a little bit. What's that?
Which clinic?
Patch, Phoenix Allies for Community Health.
Huh. Yeah, there's a lot of work that Maricopa County is doing. I don't know if you already talked with Lily Cardenas or Johanna Molina, but they have like a whole division on hard to reach populations. So, and TAPI does a lot with their hard to reach group too. So there might even be something already popping up in your communities. So that's great. Cool. Yeah, we're all worried about a lot of communities. So.
Absolutely.
Yeah, and we have some messages and materials to let people know that it's their turn. We've got it in about 9 languages now. So I'll get that posted to the same location here.
All right. Well, it's a 1:07, so I think we'll log this off. Thank you all for what you're doing, and we will see you next week. Feel free to email us with extra questions, but we have, I think, a lot of follow-up. So thanks, everybody.
Thank you.
Bye.